Welcome to the podcast. Súbele volumen. Conversation with the people who were with me. In the world TV. Carlos tonight. Historias de un reportero. Carlos tonight. Dale que viene lo bueno.
Hey everyone, it's Carlos tonight. Thank you so much for watching and for listening on your favorite podcast platform. And throughout the month, we are celebrating LGBTQ Pride. As many of you know, June is the month when communities all over come together to celebrate and honor the 1969 Stonewall riots and work to achieve equal justice and equal opportunities for lesbian, gay, bisexual, transgendered, and questioning individuals. I hope whether you're an LGBTQ or an ally, you walk away learning a little bit something from these conversations. And if you have any questions, head over to our website, carlostonight.com, and let me know. So we're going to kick things off with someone who you might have seen on TikTok or on Instagram talking about butt stuff and queer health. He's a Mayo Clinic trained gay gastroenterologist, and he's been named a top 15 gay influencer on TikTok and has been featured in Instinct magazine, among others, and works with the app Scruff to provide sexual health education to gay and bi communities. It's a pleasure to have Dr. Carlton all the way connecting to us from San Diego, California. Dr. Carlton, thank you so much for joining us. How are you?
Hey, Carlos, I'm doing great. Thank you for having me.
Yeah, thanks for being here. I do appreciate your time. I know you're busy. Let's start things off with something simple, something to start I guess the conversation and set things up. What does a gastroenterologist do?
Great question. Basically, to sum it up, it's butts and guts. A doctor who does digestive health, anything from the mouth down to the anus, with your digestive tract, including your esophagus, stomach, small intestine, large intestine, rectum, your liver, your pancreas. So I see a lot of things like heartburn and diarrhea and abdominal pain, and I screen for colon cancer, and I'll investigate things like rectal bleeding. I prevent colon cancer. I look for stomach cancer, colon cancer, pancreas cancer, liver cancer. I treat hepatitis, all of it.
Wow, you are busy.
Yes.
All right, Dr. Carlton, you have more than 258,000 followers on TikTok and more than 27,000 followers on Instagram. Why was it important for you to talk about these topics that are sensitive and often not talked about either in the media or at home?
Well, I think there's such a lack of gay sex education. First of all, I grew up in South Carolina where there's really not a whole lot of sex education to begin with, let alone gay sex education. People just aren't taught to how a gay person should take care of themselves, how we should have sex, safely, or as safely as possible, how to protect ourselves against HIV, how to screen for STIs properly. There's just such a lack of that information out there in the world. And during the pandemic, I have 2 kids, and my husband and I were on the couch one night, and we're like, why are the kids always watching this TikTok thing? We should check it out and see what's going on. So we did. And, 4 hours later, I've learned how to cook chili. I've laughed. I've cried. It's figured out within about 7 minutes that I like hairy men of color. So it knows that I'm a gay guy really fast. So, so it's a pretty amazing algorithm. And I was a lurker for about a month. And then with the pandemic, I just really wasn't as busy at work as I usually am, because with what I do, a lot of it isn't pulmonary or infection related as far as respiratory infections. So with the whole COVID thing, I was kind of shut down because I couldn't do colonoscopies for screening because it just was too dangerous for the patients, and we had to spread them out pretty far. So I had a lot more time on my hands, and I was really anxious because of the pandemic. Being a doctor during the pandemic, especially that first year, was nerve-wracking because we didn't know we were going to die just going to work, So it was a really anxious time. So I started posting some videos and just, got my feet wet a little bit. I put a video up that took off. So I had enough followers to go live. And then I thought, well, what do I know that that would help the community? First of all, I'm gay. I'm a butt doctor. I know I've had a lot of anal sex just because I'm a gay man who's 50 years old. So I've been around the block from that standpoint. Why don't I tell people how to do it right, how to make it more comfortable, how to make it a more pleasurable experience? Because there's a lot of tips and tricks that I know through my medical practice and through my experience as a gay man that I should share with other people. And so I put up a video about how to prepare for anal. I think I called it Butt Stuff 1 and Butt Stuff 2. And the first comment was from some housewife in Iowa who said, "Oh my God, how dare you put up a video about anal sex on a children's app? You should be ashamed of yourself." And I thought, oh shit, should I take this down? Should I just block this lady?
Yeah.
And so I said, you know what, I'll just block her and see what happens. So I blocked her. I turned my phone off. I turned my phone on the next morning. I had 50,000 new followers.
Wow.
And I realized that I had hit on something very, very, very relevant that people wanted to know about. And I thought, oh, it's going to be a bunch of gay dudes who are following me now. I just hit the gay community. No, it was 75% women who were interested in learning about anal sex and how to prepare for it and how to make it more pleasurable, and some tips and tricks I had. So I started posting more and more things, and I kept growing and growing. And then I really started seeing the gaps in the sex education part and the sexual health part. And so I really started focusing in on a lot of the gay community stuff that I think is important for gay health. Like things we'll talk about, like vaccines and PrEP and PET and proper STI testing. And I also branched out a little bit to Instagram because it gives me a little bit more freedom to talk to people. Right. I think it's very important to be able to connect with my followers. They have a lot of questions they're embarrassed to ask in a public situation. So my DMs are always open. People can ask anything they want to without judgment or shame or fear that I'm going to make whatever we talk about public. Right. And that's been an incredible experience in itself, because I've had people in places like Saudi Arabia or Iran or, other countries throughout the world where being gay is a crime. Telling me, hey, listen, I've got this going on. If I go to the doctor about it, I could get executed. So is there any way that you can help me with what's happening? And that has been very humbling. And that's something that a lot of people don't know about what I do is I really help a lot of people behind the scenes who otherwise don't have access to care.
Right. And Dr. Carlton, when we hear queer health, I think a lot of people think about HIV, the human immunodeficiency virus, but queer health is a lot more than that. Tell us about the basics LGBTQ people should be aware of. Absolutely.
Well, start off with vaccines. Obviously, with the whole COVID thing, we've been scrambling to get our COVID vaccines and our boosters properly, depending on how you feel about that. I think it's the right thing to do. But obviously, there are some things that happen in the gay community that are more common than happen in other communities, like hepatitis A and hepatitis B infections. Hepatitis A is usually spread through rimming. Hepatitis B is spread just like HIV through blood and body fluids. There's vaccines for both of those things, so you can get those and never have to worry about having hepatitis A or hepatitis B, which is amazing. The other thing that I think is important, as you've recently seen in the news in Florida, there's a meningococcal scare. Meningococcal meningitis is deadly in up to 20% of people who get infected. And because gay and bi men in particular it's a mouth-to-mouth kind of thing. And because of the way we play, and because a lot of times we're grouped together in bathhouses or in saunas or in gyms or bars and kissing and other stuff, it can spread really rapidly through our community. There have been scares in New York and Chicago and LA back in the mid-2000s. The MEN-ACWY vaccine lasts for 5 years. So if anybody was vaccinated back then for this condition, it's 2022 now. So it's time for an update on your vaccine for meningitis. I haven't heard much about the meningitis scare since it originally came out about a month ago, but it's definitely something. I got my meningitis vaccine today as a booster because my last vaccine was in 2016.
Oh, wow.
Yeah. So, and then we talked about Hep A, Hep B, and meningitis. The HPV vaccine, I think, is also important for our community. A lot of people think that HPV vaccines go to 12-year-old girls to prevent cervical cancer, but HPV is important because HPV causes anal cancer too. It can cause throat cancer, and we put stuff in our butts and our throat, right? And there's a lot of HPV out there, and so the virus that causes anal warts and genital warts, there are certain subtypes that the Gardasil vaccine covers that help prevent cancer. And that's really important if you're HIV positive, because there's a multiplied factor of 70 times risk for people who are HIV positive to get anal cancer if they're also co-infected with human papillomavirus. So, I think it's a pretty reasonable thing for our community to get vaccinated for HPV. It's been extended, initially to young men, and then to men up to 26, and then now there's indications for up to age 45. I think you can, if you're in the right category where you haven't been exposed to human papillomavirus and you're at high risk of getting it, if you play without condoms, and you're particularly sexually active, I think it's absolutely reasonable to get your HPV vaccine after 45. The thought about the age is probably people think that you've been exposed to it already by that point. That's why it's not as effective. But for me, an ounce of prevention is really worth a pound of cure when it comes to anal cancer and throat cancer. And then for trans women, or for women who are trans, anyone with a cervix, it's important to make sure that you get your HPV vaccine. So girls and women who still have their cervix, or trans men who still have their cervix, I apologize for that. Trans men who still have their cervix should definitely make sure they have the HPV vaccine as well. So I think, those vaccines in particular are part of our overall healthcare. Another big issue is with our STI testing. Traditional STI testing, you think of, okay, I'm going to go give a blood test and I'm going to give a urine sample, and that's all I need. My blood test is going to cover my syphilis, HIV, hepatitis A and B and C. It's going to cover my those sorts of things. My urine test is going to cover my gonorrhea and chlamydia. Not so fast. Gonorrhea and chlamydia are infections that happen where you play. So if you get infected in your throat from oral sex, or in your butt from anal sex, and you aren't infected anywhere else, if you just give a urine test, you're going to miss that gonorrhea or chlamydia infection. And what's important about that is it can, systemically affect you, but also it's easily passed on to others in the community if you aren't treated. So it's important as part of our overall healthcare to make sure you get checked where you play when it comes to our STI checkups. And a lot of people are completely clueless about that. I had a guy who said, "Oh my God, I've been bottoming for 30 years and nobody ever checked my butt for gonorrhea or chlamydia." So, you realize how kind of homophobic our medical care is, because this is pretty basic stuff that should have been recognized by now.
Yeah. I've been reading a lot about the advancement in medicine for HIV, and something that also I was reading about PrEP. Can you tell me what that is and how it prevents the spread of HIV?
Yeah, PrEP is something I think that anyone who is in a non-monogamous mode of sexual activity, PrEP is a medication that you take. And there's a lot of ways to take it, and we'll go through that. But PrEP is a medication that you can take on either a daily basis or on an on-demand basis that will prevent HIV infection. It's pretty amazing. Daily Truvada, daily Descovy pills have over a 99% effectiveness rate at preventing HIV, and that's even without condoms. I mean, I'm not telling you to avoid condoms, but I'm saying that that's a remarkable change from the 80s when people were dying from HIV infections. Now you have the chance to even prevent even getting it by just taking a pill every day. So there are a lot of ways to get PrEP, a lot of ways to get it for free. Even if you don't have health insurance, there's some ways to get that for free. And
is this something we talk to our doctor, or we visit like a community?
Yeah, if you have insurance and you have a primary doctor, you can talk to your primary doctor about getting on PrEP. There are some tests that need to be done because the side effects of Truvada in particular include kidney dysfunction. So they check blood tests on a quarterly basis to look at your kidney function to make sure you're not getting in trouble with your kidneys. Some bone density decrease. The new Descovy tablets that have come out are lower dose and have less of that. So a lot of people are switching from Truvada to that. But there's also a new method of taking PrEP where if you're not really that sexually active and you don't really have much of, and you're able to plan for sex, you can take it in a method called 211, which is not FDA approved yet, but it's used frequently in places like Europe and Australia. So say you're got a hot date on Friday night, at least 22 to 24 hours before your big date, you take that first two pills of Truvada, and then 24 hours after that, you take another pill, and then 24 hours after that, you take another pill, and you continue that until you've taken at least 2 pills after that encounter on that every 24-hour basis. So if you're only having sex once a month, you only need to take 4 pills in a month rather than 30 or 31. So especially people with kidney issues, it may be a way to really avoid some of the risk of kidney damage. But again, you have to play exactly by the letters on that. The effectiveness has been rated at about 97+% on that method. It is a lot more convenient, but again, you have to plan. You have to be able to plan for it. You have to follow the instructions, because if you miss a dose, you're really putting yourself at risk. It's not advised for people who have a vagina because the tissues don't get enough of the dose there quick enough to be effective against HIV infection, but it does hit in the rectum and penis fine. So
I was about to ask you if it was available for people, allies in the community.
Yeah, absolutely. PrEP is for everybody now. So you don't have to be, if you're sexually active and you ever don't use condoms, ever, or if there's some times where you slip up, it's a smart thing to do, because it really is effective at preventing HIV. Yeah. So now that 211 method is not to be used with Descovy. Descovy is a lower dose, and it hasn't been studied quite yet to see if that dose gets in quick enough to the tissues to be able to protect you against HIV infection. So you've got Truvada, and Descovy daily. You've got Truvada 211, and there's a brand new PrEP coming out, which is even more exciting. It's going to be a little bit hard to get in the beginning, and I actually had a discussion with our local AIDS Health Foundation today about this drug. It's called Cabenuva, or cabotegravir. Another name for it is Apretude. So this is an injectable medication. You take 1 injection every other month. That's all you need. So no daily pill. You don't have to remember to take a pill. You just do an injection every other month, and you're covered. And it's over 90. It's even better than Truvada as far as the response to PrEP, because a lot of times if you're on a daily PrEP regimen, people forget pills. I'm human. I take blood pressure medications, or other medications. I forget sometimes, So having that injectable medication as an option is really exciting. And like I said, 99% plus prevention of HIV. So lots of methods for preventing HIV through pills, and that's what PrEP is, or the injection. Obviously, the most important way to protect yourself is with condoms. Condoms prevent against HIV and other STIs. PrEP only prevents against HIV. But in this day and age of PrEP use, a lot of people just aren't using condoms anymore. And I think one of the things that sets me apart from other doctors is I'm a realist about that. I realize people aren't going to use condoms no matter how much I preach about using condoms. You're going to make your own decision about that. And if that's what if you're going to use condoms, you're going to use them because you want to, not because I demanded that you said so. People stop listening to you when you start preaching all the time. So I'm in harm reduction theory. For me, I say, okay, if you're going to get out there and not play with condoms, number one, you have to be on PrEP, period. And then make sure you're getting your STI checks done at least once a quarter, more frequently if you're more active than that. So those are amazing ways to protect yourself in a preventive mode for HIV.
So in the event that somebody goes to see their doctor to talk about all this and they get the brush off, what do people do?
Well, you can be more demanding about it. You could eat there are also other ways to get PrEP these days through programs like Hey Mister and NERCS. Those are two companies that provide free PrEP and STI testing for people. I think that's pretty amazing because I grew up in South Carolina, and I have friends who live out there who don't have access to doctors who have a clue about what PrEP is. So for them, it's a great option because they're in a rural area. And also some people aren't out. They don't want their doctor, they're in a place where their local doctor, they don't trust their local doctor to keep even though it's against HIPAA to
share information,
your medical information. They don't want people to know in the office that they have, that they're gay or they're having gay sex, or that they could have an STD or something like that. So those companies are out there now as a method to have a greater outreach for PrEP as well.
What's the process like to find a doctor who is LGBTQ friendly or LGBTQ?
Well, there's a lot of ways. I think, first of all, if you live in a bigger city where there is a big gay population, you talk to your gay friends and say, hey, who do you go to? Who do you like? Who do you not recommend? And try to figure it out that way. If you don't have a good network of word of mouth, as far as providers, the Gay and Lesbian Medical Association, or GLMA.org, has a zip code finder where you can research and see if there are gay or gay-friendly providers in your area that would be helpful in providing care for you. So that's another method. So I think that the information is out there, but if you just use those two methods, you'd probably be able to find something. Now, I can't guarantee you if you're in rural Arkansas or something like that, you're going to be able to find an LGBTQ provider. Right. But like I mentioned before, with these new companies out now to help you get PrEP, you can do at least telehealth visits to be able to do that sort of thing.
That's smart. All right. I'm talking with Dr. Carlton, a gay gastroenterologist from San Diego, California, who has a huge following on TikTok and Instagram, passing valuable health information to the LGBTQ community. And I cut you off. I'm sorry. What were you saying?
Oh, no, that's good. Hey, I also wanted to say, hey, sometimes people aren't on PrEP and they mess up. And there is something you can do within 24 to 72 hours after an encounter where you messed up that can help prevent HIV. So in a situation where, say, you don't know your partner's HIV status, you know they're HIV positive, but you don't know if their viral load is detectable or not. Most guys these days who know their status are taking their medications and are undetectable. And when someone's undetectable, they can't pass HIV through sex. Undetectable equals untransmittable, U equals U. But situation where you're out in a bar and you hook up and you don't know the status and you don't use a condom, or you're assaulted, or you have a needle stick injury with someone, there is something called post-exposure prophylaxis, or PEP, PEP, which a lot of people aren't aware of. PEP is a great way to prevent HIV infection even after the fact of a slip. So you have to go to your local doctor, or even like in San Diego, we have the AHF, where you can go right into their office and say, hey, I messed up. I'm not on PrEP. I had an experience with someone. I don't know their HIV status. I think I should go on post-exposure prophylaxis. And you take a daily pill for combo for a month for 28 days, and it has a really high effectiveness at preventing HIV infection. Now, this isn't something to do routinely, but this is something to do if you have an emergency. And I can't tell you how many people who are friends of mine who should know better and be on PrEP already, but they mess up because we're all human, right? We all are human. We have those slips sometimes. I'm even seeing in my conversation today with AHF, they were telling me that they're seeing a new rise in new HIV infections in people who were taking PrEP at one point, but just got lazy with it and forgot to take it and didn't take it right. And they messed up and boom. Wow. So, take your PrEP properly. If you're not on PrEP and you have an emergency, within 72 hours, preferably within 24 hours, but as soon as you can, contact a provider about post-exposure prophylaxis as a method of preventing HIV.
Awesome. A lot of your content surrounds butt stuff, as you mentioned. And the other day you posted, what was it? You were going to Target and you were buying some stuff. We'll get into that in a little bit. But first, describe, for someone who's like listening or watching, describe the roles in a relationship between two men.
Well, when it becomes in the sexual aspect of things, there's tops, there's bottoms, there's versatile, and there's sides. So a top is someone who prefers penetrative sex as a giver only. A bottom is someone who likes to receive penetrative anal sex from a top, or a versatile person likes both. And can be versatile in how they. Sorry, my dog.
Your dog is like.
And I was like, "That's me, man. Why miss out?" And then there's people who don't like penetration at all, and those are sides. People who like to cuddle, people who like to, you don't have to have penetrative sex for that. So. And there's a new term for that my friend Joe Court termed called sides, a side, because top, bottom, verse, side. So anyway, so I think that's a really cool thing. So there's all kinds of ways to play. And obviously in relationships, there's all kinds of ways to have a relationship. Some people are monogamous, meaning they only have sex with each other. And if that's the case, then all this need for STI testing and PrEP and all that other stuff really goes out the window if you're both HIV negative or both HIV positive. But there are a lot of open relationships where people agree that sex is just sex, that they're allowed to have sex either together with their partner and someone else, or they can separately play with other people. And that one is the latter one is the most common one that I'm seeing in the gay community in the last several years. I don't know if it's just a male thing where we just realize that men are pigs and kind of just, like sex. And we realize there's not as much of an emotional attachment to it. But everybody's different. There are gay people who are monogamous. That's great. I think that's amazing. So I don't judge what you choose, but there's lots of options out there.
Dr. Carlton, how important is knowing your basic anatomy back there, and how does someone identify their G-spot to make sex more pleasurable?
That's a great question. So when you think about your basic anatomy, if your partner is in front of you and they're bent over, obviously the anus is just a circle of muscle, a nice circle. And the external sphincter is made out of skeletal muscle, which you can control. So you can think, hey, I want to clench my butthole, and you can clench the external sphincter, right? The internal sphincter is made out of smooth muscle. So that internal sphincter is not controllable with your mind. You don't have control over that. It's only by stimulation. So you have the external sphincter, the internal sphincter, and that's what keeps you from having accidents. But those are the things that need to open up and lubricate so that you don't, so that you're able to have penetrative sex, that you don't get injured. So I have some amazing tricks on how to open that hole up, so that you have a more comfortable, more pleasurable experience. There's a technique I call the butt clock. I'm going to just use, this is going to be an over exaggeration, but there's this big roll of tape. So if you think of your hole as a circle like this, right? If you take your finger and go in about 2 inches and press over to the side right there at 3 o'clock and hold, not like killing the side of the anus there, but if you press against the anal canal, against that sphincter, firmly but not painfully,
right,
that circle starts to open up a little bit. So it starts off as this tiny little thing, and then it starts to open up. So if you move then over to 9 o'clock or down to 6 o'clock or up to 12 o'clock and hold those positions for about 30 seconds each, that hole starts to open up gradually, and you can keep going around and around and around until things really open up. So that's one of my big tricks about opening your hole. Your G-spot is your prostate gland. Your prostate gland is located just inside about 2 inches in. So if your partner is bent over and you're behind them, you go in and down. So it's at 6 o'clock. So right there. And so that'll be the prostate gland right at 6 o'clock. It's underneath the rectal mucosa. So the lining of the rectum there is going to be over the prostate. So that's the G-spot. So you don't have to go very far in. You don't have to have a 9-inch penis to go in and stimulate somebody's G-spot. You only need a couple of inches, right? Now, if they're on their back and they're facing you, then that's going to be up at 12 o'clock. Again, about 2 inches in. So that's the G-spot. And I'm telling you, in my first initial experiences as a man, I never knew what pleasure was until that was stimulated at the same time as my penis was stimulated. I'm telling you, it through the roof, rocket ship to the moon pleasure with electrical stimulation. So I think a lot of straight guys are missing out. A lot of strict tops are missing out on that amazing pleasure that comes from prostate stimulation.
Wow.
So that's where your G-spot is.
Gotcha. Good to know. What are some of the ways that bottoms can, or what are the ways so-called bottoms can do to get ready for a sexual encounter?
Well, first of all, I think one thing that a lot of people miss that's really important is fiber. Fiber helps keep you regular. It cleans up a lot of the residue in your GI tract. You know, your large intestine and rectum, they process poop. So poop normally comes out of there. So in order to be clear for anal sex, you need to make sure that your bowels are empty in that area, or otherwise you risk an encounter that becomes embarrassing or very smelly or just not, something that you can't continue to do. So some people can get away without douching. They just do fiber and poop and they do a little rinse and they're fine. Other people need to cleanse their rectum with a water solution. That's called douching, or anal douching, or rectal douching. There's a lot of different ways to douche. My advice is not to overdo it, because if you overdo it, you can put way too much water that goes in up above that 8 inches of rectum that you have. There's a sharp turn there called the rectosigmoid junction, which is what is also known as the second hole among fisters. So it's a deeper turn. That is the site of a lot of injury for people who just shove something in there, especially like people who are high on meth or something and they shove a toy up there. It goes right through that sharp turn because they don't give it enough time to relax and make the curve. But with that curve also happens if you're using a high-powered water solution to go up and around like a shower shot, water can get trapped around that turn and can flood back over during sex, and you can have like a flood of water come out during sex, which has happened. It happens, but it's avoidable if you just clean out the last little bit of your rectum. And for some people, it's once or twice they need to rinse and they're fine. Other people, it's a nightmare, and people describe being in there for 2 or 3 hours. That's ridiculous. There's no way. You don't need to be doing that. So I recommend lukewarm water. There's a bunch of fancy solutions that you can buy that a lot of doctors who I think it's kind of BS, that all these fancy things that are marketed towards us. Lukewarm water is fine as long as you're only using that a little bit. You're not going to disturb your pH balance, and your microflora are going to be replaced with the next poop you take. So I don't get too bent out of shape about all that stuff. And literally, I have been a GI doctor now for about 20 years, and I don't think there's been a single person that came in and I diagnosed him as, oops, he douched too much. But if douching affects your bowel habits, then you're probably doing it too much. So, make sure you lubricate the tip of whatever you use so that you don't scratch your rectum. Don't use store-bought enema solutions, as they contain a lot of phosphates that can irritate your rectum and cause cramping, and also cause rectal irritation that can lead to increased risk for STI transmission. So my recommendation is just lukewarm water. If you're on fiber, it helps kind of just do a little rinse after, especially after a bowel movement or when you're about to have sex. There's one thing that people should know about called the gastrocolic reflex. There's a lot of jokes that you see about bottoms not eating all day, or you see two guys out for dinner and one's got a big plate of food and one doesn't have any food, and you can say, "Oh, I know who the bottom is." The science behind that joke is that there's something called the gastrocolic reflex, where when you eat, it stimulates your rectum to empty, with usually within 5 to 15 minutes, but sometimes within an hour of eating. So it's not advised to go out and have a big meal and expect a bottom as soon as you get home, because you could have a lot of movement down in your rectum. You want that area clear. So I recommend, not getting too crazy with eating for about an hour before you play. Don't become bulimic or anorexic, about sex. Be reasonable, but it's a smart thing to do not to eat an hour before sex. Fiber and clean out with water, lukewarm water, so you don't burn yourself with too hot. You don't cause cramping with too cold. And then whatever device you use, it can be a shower shot, which attaches to your shower. Make sure you lubricate the tip. Don't turn on the volume of water too high. Or you could use a douche that you buy from a lot of companies that gently slide up in there, and you squirt the solution in, let it go, and then repeat as needed until things come out clear. So all the jokes about the water's not clear, it means you keep squirting water up in there, it floats out, it's still brown. So that whole, I can't stress enough how much fiber changes people's lives when it comes to douching. Now, not everybody tolerates fiber, but if you tolerate fiber intake, it really does a good job at preventing hours and hours of douching.
Yes, that's something you can buy at Target, which is I was talking about earlier, a video you did when you went shopping. That was pretty cool.
Yeah, I was surprised at how big a hit that video was. All I did was go into Target and pick 3 products that I thought were great for people who bottom or people who have problems with their butt to get. Number one is fiber. Fiber helps prevent hemorrhoid formation and fissure formation, and it makes bottoming easier because you decrease the residue in your colon and keeps you regular. And the second thing I recommended was a shower oil that you can just wash your butthole with to keep it sort of moisturized, but not too moist. Swamp ass is a real thing. Swamp ass is where you get really itchy and cracked and irritated back there from, working hard all day or sweating a lot or whatever. This stuff is really good at decreasing irritation from that. I'm sorry, I just used a Southern term called swamp ass.
I've heard that before. That
I think people can get the picture. And then finally, if you're having rectal pain, either from hemorrhoids or from a really rough session, some of us have them, you can put a couple of cups of Epsom salts and some warm water in about 3 to 4 inches in your tub, and 3 to 4 inches of warm water, and soak in it for about 15 minutes. And it really helps soothe and decrease the inflammation back there. And you can do that up to 3 or 4 times a day if you're having a lot of some pain back there. If it's severe pain, your doctor. But if it's just kind of like mild to moderate pain, you can sit in the tub, and it helps decrease hemorrhoid swelling and all kinds of things back there.
Oh, wow. Something popular among the community is something called poppers. Tell us what they are and how they can be dangerous too.
Good question. Poppers, no doctor's ever going to tell you how to use poppers because it's a chemical, and we would be shot if we told you to use them. But I realize that people are going to use them. They're really popular in our community. So the scientific explanation about how they work: poppers are amyl nitrite based. They got their name because in the 60s they were used as a medication to dilate blood vessels around your heart. They were in a little poppable capsule that you had to pop open, and then you would sniff it. And once that amyl nitrite got into your bloodstream, it would dilate your blood. Had a narrowing to your heart arteries from a coronary spasm or a heart attack, it would decrease that spasm and allow things to relax. So it relaxes smooth muscle. Well, remember what else I told you was made out of smooth muscle? Your internal sphincter. So by relaxing the smooth muscle through amyl nitrate, not only are you relaxing smooth muscle in your blood vessels, but you're relaxing it in your asshole if you're bottom, or even in the vagina if you're, for women or for people who have vaginas. But again, because you're dilating smooth muscle, you're also dilating your blood vessels. So people get an intense head rush because all that blood flow just starts pulsing up to their head. The dilation in blood vessel width also causes a drop in blood pressure just by physics. And so people can get kind of lightheaded and faint because their blood pressure drops. That is dangerous in a situation where you're in a steam room or a sauna or a super hot, sweaty dance floor. Because if you overheat, your blood vessels are also going to have a tendency to kind of dilate open a little bit too, to try to get flow. I don't advise them to be used in steam rooms or saunas or bathhouse situations because it can lead to a dangerous drop in blood pressure. I've had a lot of people say, "Hey, I was in a bathhouse in Spain and some guy had a heart attack and died in the sauna because it was 140 degrees in there and he was sniffing poppers left and right." Wow. So, there's a smart way to use things. If you're going to use them, know your limits. Don't use them if you have blood pressure problems or if you have cardiac disease or neurological problems, or if you use them once and you have an adverse effect, then don't use them again. Another big thing that our community, especially people more my age, Viagra, Cialis, those medications, they have an effect where they also are nitrate based and they dilate blood vessels. They dilate the flow to your penis. So, but if you take the combination of Viagra and a popper, it drops that blood pressure even more, and you can have a stroke from just the lack of blood flow to your brain. Wow. So it's really important, these things to just be aware of. Now, it doesn't mean it's going to happen to everybody, and it doesn't mean it's going to happen to you. But these are things that, as far as my harm reduction protocol is, if you're going to use poppers, and I'm not going to tell you to use them, but if you're going to use them, at least don't use them if you have a lot of health conditions. If you're going to use Viagra, if you're going to be in a hot space.
What a great segue. We were talking a lot about bottoms, but for the tops, something a lot of people in the community deal with is erectile dysfunction. You kind of mentioned that. What does erectile dysfunction, is it caused by like weight, food, alcohol?
Well, a lot of factors, a lot of factors happen with erectile dysfunction, including blood flow. So it's basically a blood flow condition to your penis, so that your penis isn't getting enough blood flow to the vessels in there to dilate enough to give you a good rock hard penis for a penetration event. And sadly, with butt stuff, you need a good hard penis usually to be able to penetrate, because that sphincter is so tight. It's kind of hard to get in there if you don't have a hard penis. So erectile dysfunction, a lot of factors, including anxiety. You can be completely attracted to somebody and think they're the hottest thing on earth and get in your head about it, and then get to time where it's time to have sex with them and then just not be able to get hard. And that's the most frustrating thing in the world. Sound like I speak from experience there. And then there's people who have blood pressure problems, who are already on blood pressure medications, or even psychiatric medications like antidepressants. It can make it hard to get an erection. People with diabetes, people who are, you've heard of whiskey dick, where you can't get your penis hard because you're drunk. Mm-hmm. So all those things play a role. There are medications out, like I mentioned, Viagra and Cialis. Viagra is an immediate acting thing where you take it, and within an hour to up to 6 hours later, you can get hard. The main side effect of that, again, is headaches, because again, you're dilating those blood vessels. Also stuffy nose, because the vessels to your nose also dilate a lot.
But Viagra is something you have to get from your doctor, right?
Well, technically, yeah. I mean, it's a prescription. But there's a lot of ways to get it. You can get it from your doctor. You can do these telehealth things where you like from
like a mail order thing.
Yeah, where you can get erectile dysfunction medications through the mail, as long as you have a doctor's visit online or on the telephone. Cialis is a longer acting one. We call that the weekender. It's a medication that, unlike Viagra gives you the ability to get hard within about 6 hours, 1 to 6 hours after taking it, and then it wears off. Cialis, that ability happens for up to 48 hours after you take it. So, if you're going away for the weekend, you're going to be playing a lot. You want to make sure you're able to get hard. Cialis is a good option for people who have erectile dysfunction, because it lasts the whole weekend. This stuff does not make you hard. It does not make you orgasm. I mean, alone, it doesn't make you hard. It doesn't make you orgasm. You still have to be stimulated. You still have to be interested. It's not going to make you horny either. You have to be interested in sex for the stuff to still be able to work. So don't expect don't expect it's going to make you horny, or it's going to instantly make you have an erection if you're not stimulated. Right. Another thing that, before I forget, if that stuff doesn't work for you, there's a newer thing out that's an injectable. Now, a lot of people think of injecting a needle into their penis as like the end of the world, and there's like no effing way they would ever do that. But there is an injectable medication called Trimix, where Trimix, you have a tiny little needle, you inject it in, and your penis is rock hard. I mean, like rocket fuel. It's incredible. That can last. You don't want it to last more than 4 hours, because that's not healthy. But with the help of a urologist, if you're not really flying very well with Viagra or Cialis, then this stuff is really another good option for people who just are still struggling. And there are guys out there with diabetes, with hypertension, who struggle.
Yeah.
But man, this stuff is it's like a magic wand. It's incredible.
Makes you feel like Superman.
Totally. So you have to be able to put a needle in your penis.
Ooh.
Yeah, that doesn't sound fun.
I keep imagining while you're talking is the episode of The Golden Girls when Blanche's daughter is trying to get pregnant, and they're all talking about how she's going to do that because she's single. And when they find out, they're all like, ugh.
Yeah.
So I keep imagining B. Arthur's like, ugh.
Yeah.
Anyway.
That's awesome.
So let's talk about body image. I think it's a problem in all communities. Why do you think it's such a bigger issue in the LGBTQ community?
Well, I think especially among gay men, the perfect body is something that has been marketed to us for 4 decades at least, if not 5. That whole image of having to have no body fat. This isn't, X isn't sexy, Y isn't sexy, or, A is sexy and B is sexy, but not this. So, everybody's different in what they like. Some people like chunky guys, some people like dad bods, some people like bears, some people like cubs, some people like muscle. That's okay. But I think those stereotypes are reinforced in so many aspects of, you see it on Instagram where, everybody's like shirtless and There are a lot of guys who are breaking these stereotypes that are bears, or, and, in the traditional marketing standpoint, you would never have seen that in the past, but these guys are very proud about their bodies and they don't care. And like, even kind of on the straight side, like Lizzo, you see Lizzo now, she's getting out there. She's got a big old ass. She don't care. She's making money. She's making hers. So I don't think we should either. I think, do what makes you happy and find your crowd that makes you happy and that likes you, and go with that. I suffered from body image problems big time. When I was in my 30s, I thought I had to be this, gay man with a perfect body. And I was working out like crazy. I had hired Mr. California to be my trainer at the gym. I was taking testosterone, and I wasn't eating any carbs. And it basically got to the point where I was 6'3" and I had gotten down to about 168 pounds, and I still thought I was fat. And I walked into one of the hospitals where I worked, and one of the cancer doctors came up to me and put her hand on my shoulder and said, "Hey, Carlton, are you okay? Do you need to come see me?" Like, she thought I had cancer.
Yeah.
That's how skinny I was getting. But in my head, I was fat. And so, I'll be the first to admit that I've even had my own issues with body image problems because of what has been drilled into my head for so long as to what's sexy. So I think that we have to get beyond those things and just find our own, how we're comfortable in our own skin.
4 aspects of body image, including the way you see yourself, the way you feel about the way you look, the thoughts and beliefs you feel about your body, and the things you do in relation to the way you look. Are there ways to improve body image?
I think, reinforcing yourself, to yourself, to stand in front of a mirror and look at yourself and tell yourself that you're beautiful. I think that's a really big way to reinforce body image. When someone compliments you, take those compliments and hold on to them and say, "Hey, yeah, they really like that. That makes me feel good."
Lizzo does that in her concerts before she starts. She makes
I saw Lizzo live in San Diego, which was awesome, and that's exactly what she did. She goes, "You are beautiful. You're enough. Stand in front of a mirror. You are enough. You're beautiful," and I love that.
Yeah, it's great. How dangerous can body image become? Can it lead to like drugs or alcoholism?
Oh, it can lead to a lot of things. It can lead to anorexia, eating disorders, bulimia. I think I almost had an eating disorder. I was so skinny, It can lead to emotional problems like anxiety and depression. Like, you don't feel like you're good enough and you become depressed about it. And some people even suicidal. Yeah. I think it can lead to substance abuse, testosterone abuse, cocaine abuse to kind of get that look, So I think that it's really something that we ought to talk about more.
Dr. Carlton, I think what you're doing on TikTok and Instagram is helping a lot of people in all communities of all ages. What's the reaction you've been getting?
It's been pretty crazy, I have to tell you. I've had I never expected this. I never did this for attention, but I went to Bear Week in Provincetown last summer, and I would walk down the street, and every 5 feet, somebody would be like,
Dr. Carlton,
can I take a picture with you? Dr. Carlton, can I take, let's talk about butt stuff, or can we do a TikTok together? That's great. I mean, the fame part of it, I don't consider myself famous. I consider myself gamous because only gay people have a clue who I am. But to go into a bar, no matter where I'm at, people go, "Oh, you're that guy from TikTok," or "You're that guy from Instagram," or "I love your videos." That's really cool. It means it's getting out there. And I know, feedback on Instagram, bottoms say, "Hey, I had a top come over last night. I didn't tell them to butt clock me, but they totally butt clocked me and loosened me up before sex. And so your information is definitely getting out there." So that kind of cracked me up. I had one guy get a tattoo of me, and I didn't know whether to be terrified about that or to celebrate that.
Yeah.
Kind of like a rock star thing,
Yeah.
But that was kind of cool. And I think the funniest thing that's ever happened was I was in Provincetown during Bear Week, and I crossed the dunes where, the guys are playing in the dunes. And I was just crossing the dunes to go pee, I promise. Scout's honor. These two guys were going at it big time in the reeds. And I walked within about 6 feet of them, not realizing they were there. And they just stopped mid-thrust and said, "Oh my God, we love your videos." I was like, "Carry on, boys, carry on." That was pretty awesome. And then, I was in New York City not too long ago with my kids who were 17, who think I'm not cool at all. Got stopped on the street in New York City by some fans, and they're like, "Wow, okay, this is kind of cool,"
Yeah, that's doing it. Cool.
The reaction has been great. People really appreciate it. People are hungry for the knowledge. People in places where they can be executed are really grateful and thankful for the resources.
Absolutely.
And so now it's just a matter of kind of moving forward from this point and trying to spread the message more.
Yeah. Well, you're changing a lot of that, and motivating, inspiring people. Tell us how we can connect with you. Where can we find you?
Yeah, well, my TikTok is Dr. Carlton, all spelled out, DoctorCarlton. Same for Instagram. My Twitter is Dr. and Carlton, separated by an underscore because the other thing was taken by the time I got to it. I do a lot of events. I was a headliner for Austin Kink Weekend in Texas over the April holidays. There's going to be some other live events coming soon, including one in San Diego. I'll keep people up to date on my Instagram and TikTok about what's happening. Certainly do lives with Scruff. That's been an amazing aspect of this as well. Scruff wanted me as their sexual health expert. Mm-hmm. So I go live on Scruff apps, Instagram, and I do TikToks and Instagram reels for them to educate the community. So you can catch me there. But hopefully there's a lot of things I can't talk about yet because they aren't signed, but there's a lot of exciting things happening coming up, and keep your eyes out.
That's so awesome. Dr. Carlton, thank you so much for your time and your insight. I really appreciate it. God bless you, and happy Pride.
Thank you, Carlos. Happy Pride.
And that's a wrap. Thanks so much for watching, and of course for listening on your favorite podcast platform. This episode was written and produced by yours truly, Carlos Correa. My theme by Skin Gales. Visit carlostonight.com for the very latest on the podcast, see upcoming guests, and check out past episodes. That's carlostonight.com.